Hello everyone, my name is Dr. Anand Sinha and I am the Director of Pediatric Surgery at Fortis Memorial Research Institute, Gurgaon in India. Today I am going to share a topic with you which is very close to my heart. Not just because I am a doctor or a surgeon, it is also because I am a father of 2 children, and this is a problem that probably every parent in today's time has faced, me included. And that is why this topic is something which I always hold very dear to me. Now, it is 2024 right now, and we have recently undergone a pandemic which we really suffered. COVID, of course. Fortunately, children were less exposed to it. That was very good. But we are facing another pandemic. Universally, across entire world is facing this. It is on the rise. Almost every other patient who comes to my OPD is in some ways related to this. And that is another C, not COVID, but constipation. It is very common these days. And I am a surgeon. I don't primarily deal with constipation. You may be taking your kid to a family physician, to a pediatrician, probably a pediatric gastroenterologist, but only when you land up with complications because of constipation that you need to come to us, pediatric surgeons also. But having said that, the number of children that we see with complications due to constipation is immense. And it is something that we are treating very frequently these days. And that is why this topic has now become very pertinent in our society. There are various factors. I will try and explore into these. I will not go into the details of every cause. I will just brush up because this is a huge topic in itself. What is constipation? So constipation can be defined by frequency or consistency. Basically, if you are not passing soft stools, it is called constipation. If you are passing hard stools, it is constipation. Or you are not able to pass stool every day. You are able to pass stools once in 5 or 6 days, or you need some kind of a support to pass stools. It again qualifies as constipation. Having said that, there is no fixed definitions. There are some definitions put out by various institutions, but if you suffer because of stool consistency or its frequency, you have constipation. In children, constipation can present simply as parents coming to us and telling us the child is not able to pass stool easily. The child is straining while passing stool and passing really hard stools. So that qualifies as constipation, uncomplicated. But to our surprise, constipation is very commonly missed these days. A parent typically will come to us and tell us that, my kid is not able to pass urine properly. You explore, you look at urine infections, you look at some kind of bladder problem, you look at kidney problems, and then you finally realize that the child is not having any of these, but simply hard stools. The parents don't notice it. When we ask them whether your child has constipation, they will simply reply to us that our child goes to pass stool every day. But that does not mean that the child does not have constipation. When we investigate, when we do an X-ray and just see the child is loaded with stools, and to that extent that the child is not able to pass urine, in some cases we have to admit the babies to in fact catheterize, means we pass in a catheter into their bladder so that the urine comes out, and then once the constipation is treated, we can remove the catheter and the child is able to pass urine properly. This is just an example. This is just something which happens every day. I will enumerate the kind of complications a constipation kid can have. And I will start right from below. Simply, passage of blood in stools is very common with constipation. It can happen because the child has a fissure, which means there is a cut on his anus, which is caused because he passed some hard stools. And that cut leads to very painful passage of stool the next time and passage of blood. Another case may be a rectal polyp, in which a part of the large intestine protrudes into the lumen because the hard stool was pushing over it. When the hard stool was pushing on the mucosa or the inner lining of the large intestine, some part of it came down, elongated, and formed a polyp. This polyp again is prone to bleeding. The surface ulcerates and then you get some bleeding in the stool all the time. to that extent that you may present with severe anemia. You don't even know that you had anemia because you had a polyp. Then you can have hemorrhoids. So normally hemorrhoids or piles is a disease which we see in adults, not in children. But nowadays we are seeing that some kind of external piles are seen even in children because the heart stool presses on the veins. These veins then they get enlarged, bluish, and you can see them outside. That again is a telltale sign that the child had constipation. If you go a little higher up, these children who have constipation are very prone to infections, GI infections or gastrointestinal infections. So they will have gastric upset, loose stools far more commonly than a child who does not have constipation. These can also present as mesenteric lymphadenitis. Now, mesenteric lymphadenitis is a disease where lymph nodes in our body. Now, lymph nodes are small glands which are present right throughout our body and act as soldiers, or basically they prevent infection from entering into our body. So there are lymph nodes along the entire course of our intestine which are called as mesenteric lymph nodes. These get enlarged. The children will present to us with pain. The children will have difficulty in eating. Their appetite will be low. And when we get an ultrasound done, you will very commonly see mesenteric lymph node enlargement. Again, very common in children who are constipated compared to children who have regular bowel movements. Then, one very common surgery that we perform is acute appendicitis. And trust me, more than 90% of children who come to us with acute appendicitis have a history of constipation. What happens is a hard stool particle goes and lodges on the mouth of the appendix, and the appendix is not able to drain its natural secretions. It gets collected and finally it gets infected, leading to acute appendicitis, even perforation, leading to pus in the tummy, and they present as acute appendicitis. So it is a risk factor for acute appendicitis as well. Again, very commonly it affects the urinary system, as I told you in the example. You have hard stools, it presses just below the bladder, does not allow your bladder to empty properly, and you get all kind of urinary problems which you don't even feel it was because of constipation, but they actually are just a sequel of constipation. The children who already have a pre-existing disease in the bladder or kidneys or any kind of obstruction, we are very, very emphatic in telling them that no, this has to be managed very properly. Constipation is not acceptable in these children. So once you have a urinary problem, it becomes even more important. But even without having a urinary problem, just simply constipation can make your bladder habits go haywire. You may not be able to pass urine well. You may have dribbling of urine. You may have retention of urine, means you are absolutely not able to pass even a single drop of urine, which needs catheterization. If you already had a urinary problem before, it will get worsened. So constipation in urinary children definitely is a thing which has to be taken into consideration very, very carefully. Then if you are constipated, you are all the time full of stool in your body, so your appetite goes down. You don't eat as well. When you don't eat well, your growth is hampered. So a lot of times children just come with this complaint that my child is not gaining height, my child is not growing well, he is not gaining weight as he should. And finally you just realize it's simply constipation, and once you treat the constipation, everything comes into place. So it can present like that. Now I'll tell you even something more surprising. Children who have problems with their mental acuity, some conditions like autism, or some children having some difficulty in their learning, also is related to constipation. It is said that the intestinal flora of our intestine directly relates to our brain development and brain growth. So if your intestinal flora or the bacteria which are there inside our intestines are not healthy, are not right, then that can indirectly affect your intellect, your learning ability as well. There have been cases where we've seen that the child, once treated with constipation, actually improved in his learning also. So it is surprising to hear, but constipation can affect that too. And that is why constipation becomes so important. It is just simply constipation, right? But it can affect you in so many manners. that it has to be treated well. Let's just go into the causes of constipation in short. Constipation most of the times is related to your diet. Now nowadays, I can't say this, probably it needs more research, but the amount of processed food that we eat, the amount of junk food that we have nowadays is definitely one of the causative factors why constipation is becoming more and more common these days. Easy food, easily cooked, easily available foods which are not cooked properly definitely are playing a role why constipation is so common nowadays. I am not against this, but having both parents working again sometimes lead them to not realize that their child is probably not evacuating stool as much as the child should. So they go sit on the potty, they just pass small amount of stool, their urge to pass stool is gone and they are back to their activities. There is a lack of patience, there is a lack of involvement on the part of parents also, because they think that probably the child has passed stool, but in reality they have just passed a little bit of stool, not given enough time, and the stool keeps getting collected inside their body and keeps becoming hard over a period of time. That's also one of the reasons. So habit is one of the very important reasons for constipation in today's time. Children addicted to mobile are watching their mobiles or watching television or playing something. For them, passing stool is basically just a wastage of time. So they will wait till the last moment. They will not go and pass stool. Once they go, they will just come out immediately as soon as their urge is gone, and they would have not completely emptied their large intestines, and that keeps collecting and results in constipation. You don't even come to know because the child did go to pass stool. So it is important that we also pay a little bit of attention on our children's habits, see that they are spending enough time. Now, spending enough time does not mean that they're just sitting and not passing stool. Sometimes when you have difficulty in passing hard stool, you spend more time, but you actually don't pass that much of stool. So that's also not good. But just passing some stool and coming out in a short bit is also not good. The child should go there. It should be a comfortable environment. He should be able to pass stools smoothly without having any discomfort and should evacuate his large intestine well. We should also be able to monitor it a little bit. We need a little bit more involvement on our part to see that that's happening. So most of the times constipation is because of this. Sometimes there are other diseases. For example, Hirschsprung disease. Now that is a disease which is treated by us as pediatric surgeons. Here there is an absence of a particular cell called as ganglion cells in our large intestine, which does not allow the stool to be passed. I will probably discuss this in some other video, but that can also lead to constipation. So we need to be careful that we are treating constipation, and if it is not getting treated, we should start looking at other causes, which are not as common, agreed, but still needs to be picked up on time so that we can treat them effectively and do a proper job with them. As far as treatment is concerned, I am not going to go into the surgical causes because they require a complete different video. But in general, what do we need to change? We need to change the diet, we need to change the habits. In diet, most important, let your children have a lot of fluids. Water, coconut water, lemon water, fresh juices, any kind of liquids. A lot of water in your body means softer stool. Second, fibers, something which is very important in today's times, which we usually neglect. A lot of vegetables, a lot of fruits. Every main lunch and dinner should have adequate amount of vegetables which provide us fibers, and our snacks should actually be fruits so that you get some fiber in form of fruits also. There are some food which are particularly rich in fibers, for example prunes, figs, dates, which you can include in your daily diet for the child so that their constipation becomes better. Then in children, fortunately, we are not too worried about their weight gains that much. So things like ghee and butter also act as natural laxatives. They can always help in smooth passage of stool also. There are certain things that we should avoid. One of them is milk. So it is surprising that milk is one of the commonest cause or a commonest culprit which causes constipation. It is a ready-made food, easily available. Commonly parents will think that, at least my child had milk. But that is not right. Milk is a good source of protein, milk is a good source of calcium, good for growing children, but we should know that milk is very constipating. So it has to be taken in moderation or in a refined form. For example, give them curd, give the baby paneer or what we call as processed cheese or other things which can give you all the benefits which milk provides, but avoid the constipating effect of milk. A second common thing is refined flour, or that is basically the common component for a lot of junk food. Noodles, pastas, pizzas, burgers, a lot of breads, a lot of biscuits are made of refined flour, and that also causes constipation. So we should try and avoid it as much as possible. Focus on whole grains, focus on wheat more than refined flour, focus on other things as well to provide nutrition to your child. In all cases, avoid junk food. Junk food directly may not cause constipation, but they will fill your child's tummy, and the child will then avoid eating healthy food in form which provide a lot of fibers. So you should avoid chips, chocolates and other things which will take up a lot of calories requirement of your children, and then they will not eat the healthy food. So these are common things, easier said than done. It is very easy to say that you change all these habits, but it may be difficult. But it is very essential that we do all these things so that we avoid constipation in children. A lot of times you will need help from your doctors. They will need some kind of laxatives which may go for a prolonged period of time. Nothing to worry. As long as your child is pooping well, we are happy, even if he is taking laxatives. He may require some more form of creams to be applied in his anus area so that passage of stool is not painful. And then of course sometimes you will require surgeons like us who will take care of these complications and take care of some of the causes like Hirschsprung disease if they are present. But the take-home message will be, constipation is frequently missed. Constipation can present as any other problem inside our body. Very important that you take notice of your bowel habits of your child. Also take care of what he is eating, how much he is eating. Simple measures go a long way in avoiding constipation. Thank you.